hello, very beautiful, whatever you are. This is a video about the interaction of myalgic encephalomyelitis and COVID from a patient's experience. So I have moved from 2 or 3 hours a day working from home as my previous baseline to 2 hours every 2 days. My experience has been 0, sort of complete otherworldly knockout, and then some productivity the next day, and then ba-doom, ba-doom, ba-doom. ME comes with lots of symptoms. Here are some of them. So when we're talking about new symptoms, they are things that are laid on top of what was experienced before by the patient, right? So it's not like, oh, I got, bumped in the face and it was bad. It's an elephant was standing on me and then I got bumped in the face on top of that, and then the second elephant stood on me. Distinctive features of my experience of additional symptoms are head, so concussion-like feeling, often dramatically so, disconcerting disturbances of perception, and often a kind of zoning out that is almost equivalent to the onset of general anesthetic. Chest, boot on chest and very erratic cardio story and breathing difficulties. And then the regular feeling of toxicity you get with ME, because you feel like you're getting poison all the time, now feels a bit worse and a bit more like drowning, and it feels a bit more chemical. So it almost feels a little bit more artifactual in its experience. So let's look at a bad moment in practice. Not a very bad moment, just a bad moment. Chest pain radiating to the back, can't take a full breath in. Feel like somebody's trying to squash my legs out of existence. Extremely weird concussive head stuff. Able to control swallowing, but it's a bit on the margin. It could tilt the wrong way. Extreme sensation of sort of toxic poisoning across the body. And a bit of a noose-like feeling here. Having to work through an uncomfortable state to keep on breathing. And it's not an extreme moment, but it's a moment to get through, which means it contains both suffering and an absence of what we all love, which is doing things we love. Let's do some emotional tips. One thing you're going to feel inevitably is regret. And regret is the neurotic circular thought, oh, if only I'd just done this differently, I wouldn't have never got it. If only I hadn't exposed myself in this way, or if only that hadn't happened, then I wouldn't have got it. And obviously you've got to know that that's not constructive. It's a bit like me lying here and asking, why am I so fat? Why am I so fat? Why am I so fat? That's actually going to be a question that I ask that leads to the preclusion of my engagement with the question of why I've got so fat, right? So know that, but also be gentle on the part of you that doesn't want to be gentle on you and keeps asking and re-asking this question. Next emotion I want to deal with briefly is grief. So that's loss relative to your previous baseline. So I've just described, I've gone from 2 or 3 hours a day working from home to 2 hours every 2 days. But here is what's interesting, right? Grief begets grief, and a sense of loss begets all the other senses of loss. The patients who are going to do best with this difficult predicament are going to be the patients who dance more with the limitations of their condition. And the patients who are going to do worse with this are going to be the patients who are most rigid about this. And what's the difference? Well, if you're rigid about it, about your condition, about your ME, it means that you experience your me as an external object that has come from outside and assaulted your life. I'm not saying that's not true, but I'm saying that that is a rigid and unprocessed relationship to the condition, because after all, constitutional vulnerability is a part of life. And even people who are perfectly healthy are potentially not healthy if, God forbid, something happens to them. So the difference here is that the rigid view sees the condition as an external assault, whereas the dance sees it as part of life. It is life giving you something that you don't want, but it's still life. Not just an assault on your life, it's still life too, because it is part of life to receive things you don't want. We're not doing this sort of heebie-jeebie sentimental kumbaya story, everything is meant to be. No, not at all. There's a tragic element to life. But what we're saying is that the tragic element is part of life too. And the dance recognizes that. A rigid approach says, no, 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 it's an outside force that's come to get me. A small aside remark. Now, of course, if you're going through a similar experience, one of the things you're going to say, Vlad, shut up. I can't even feel any of these emotions you describe because I'm in a tumble dryer of volatile symptoms. And that's my experience, the tumble dryer, the washing machine. So go away with your emotional processing. I'm not there yet. And that's true too. Let's talk about fear. Right? Having said a little bit about regret and grief, let's talk about fear. So the fear is that you're going to have a reset of your underlying baseline, a reset of your ME, and not just with your regular symptoms getting worse, but with new and weird symptoms coming along and being permanent, right? Why do I feel like I have a terrible concussion, even though, you know, despite my 20 ME symptoms that I felt before, this feeling of a concussion wasn't one of them? And is that going to be added on top now? And how will I cope? And here, again, the same advice applies, right? Be gentle on the part of you that doesn't want to be gentle with you, right? So don't beat up the part of you that goes around being afraid. Don't tell it, stop being afraid, you're silly, you're irrational, it doesn't help. Be gentle. And that gentleness, if anything, will help to somewhat wash away a sort of compulsively fearful reaction to the experience you're having. Now, another emotion is departure, and I want to acknowledge that, right? Now, you're going to be okay because, you know, you're likely to you know, have a good chance of getting back to your baseline. But there's this feeling of departure, that you're departing from the world because your symptoms are worse, everything is more strange, and there's this feeling of distance. And then there's this feeling of attempting to somehow forestall this departure and latch on. But every time you try to latch on, it just keeps going away from you and you keep going away from the world. That's understandable. It's an understandable thing to feel. Then there's going to be a practical problem. And that's when you're too sick to do the basic things you need to do to keep yourself physically stable. So one of the things that you might not be able to do is rest well if you feel too ill, right? That's true generally with ME. This is what people with severe ME all the time experience, but it could be something that's happening to you on a new level if you've got myalgic encephalomyelitis and you're recovering sort of weeks out from COVID. Now, it's important to understand a general truth about resting that applies in a very special way in this case. And that is that resting is not doing nothing. It is doing something that is both extraordinarily important and extraordinarily difficult. So give yourself that self-directed celebration, right? It's hard. I mean, look, I am an infinitesimal public intellectual. I talk to my community on the YouTube channels. And often it is actually easier to talk for 30 minutes from bed to my community than to do systematic rest, because you can sort of build yourself up and push through with that conversation, whereas you can't push through with resting, right? You have to relax, and the more you relax, the more you sort of intensively feel the symptoms you're experiencing. Let me introduce just a final distinction here that may be helpful. We've already elsewhere talked about distinction between disability and suffering, which is important, right? Don't confuse how limited you are in functioning with how much you're suffering. Right? They're separate things. They don't always go together. There's a distinction between stable and volatile states, right? Are you different every 2-hour block, or are you sort of stable all the way through the week? That's an important distinction that's really helpful for chronically ill people if you are an outsider, if you understand it. There's also a distinction between safe and unsafe suffering, right? If you're in acute physical pain or a lot of physical pain and it gets slightly worse, you'll probably feel safe because you know what that's about, what that state's going to be about, even if it gets worse. But if you've got breathing and swallowing problems, let's say brainstem mediated, and somebody tells you, well, you're going to get 20% worse soon with that, that's not safe because you don't know what getting 20% worse with that means. So these are 3 distinctions. Let me now introduce a 4th, which is between what I call tolerable and intolerable experience. Now, there are tolerable and intolerable physical states. A tolerable state, with the way I use this term, is one in which even if it were permanent for the rest of your life, you would still prefer it to, and I have to be careful here because of YouTube regulations, you'd prefer it to not being a beautiful human being living a life in the world. An intolerable physical state is one which, if you had to feel it every day of your life, you would on balance prefer to not be a very wonderful, very beautiful human being making your way around the world. And it's a very important question to ask chronically ill people. It helps them be seen. How much time do you spend in intolerable states? And, it'll help you understand them a lot. If they say, well, you know what, for me, normally it's 15% of the time, but now it's 65, right? That could be helpful. Thank you so much for being with me. I hope some of this was of value. Lots of love.